Good morning, everybody. And my last COVID briefing was back on October the 25th. On that date, I issued a warning of the situation surrounding COVID if it's gotten worse, directions that we may have to go into if we need to improve the situation that we're in. But sadly, last night, we had a man in his 60s pass away from COVID-19. My prayers and condolences go out to the family and to the 440 people that lost a loved one through these difficult times. It's hard to believe it's been 23 months that we've been dealing with it, and I know people are over COVID. COVID's not over us. I know people want to be out of the situation. I was at a funeral services for family members Sunday and Monday, and I had people coming up to me consistently saying, "Hey, I'm triple vaccinated, take off the mask." And I'm like, no, leaving my mask on. And not just for me, but for people that aren't vaccinated. And having a granddaughter that's 4 months old, that's been living with me, I have to make sure I'm even more cautious when I'm out and about and seeing people when I go home. And people don't get it. And that's been the hardest issue. The $1 million question people keep saying, why are our numbers worse than it was a year ago when we didn't have vaccine? And we did say, if you vaccinate and you get the 2 shots, you don't have to wear a mask if everyone in the room's vaccinated. We did not say you weren't going to get COVID-19. We did not say it wasn't going to happen to you. And I don't know why, and I say this all the time, people think now they got an S on their chest. And I will say to the people listening to this and to the viewers, just walk around. Go into any store. No one's wearing a mask. I've been very alarmed that people over 65 that aren't wearing masks that are out and about, because people are like, we got the shot, and I get it. No one wants to wear the mask anymore. Everyone's done with COVID. No one wants to read about it. No one cares. But there's still people dying, and there's still people getting sick, and there's still people who are getting COVID, don't realize they have it, and transmit it to someone else. I've watched, my 2 brother-in-laws are fully vaccinated. Both of them just got COVID last week. My niece got COVID, fully vaccinated. And you see this happen because people are out and about and they just get it. They weren't sick. They just got it and had a quarantine for 10 days even though they were fully vaccinated because they had COVID and they had a head cold. So as of today, there's 115 new COVID infections in the last 24 hours. We've been seeing new daily increases, triple digits, more and more lately. Last week we had a 5-day stretch, and on Thursday we had 191 confirmed COVID cases, the highest single day increase since January 28th of this year. Since yesterday, there were also 8 new hospitalizations, 41 county residents currently hospitalized, up from 38. 1 hospitalized person younger than 18. There are currently still 4 people in the ICU, unchanged from yesterday. And it's important that we remember that the situation looks like this time last year ahead of the holiday season. So if you go between October 24th and November 24th of last year, talking last year, there are 1,756 cases of COVID infection, 113 new hospitalizations, and 8 new COVID deaths. Now let's compare it to last month of this year. In 2,764 new infections, 136 new hospitalizations, and 19 COVID deaths. So it was much better this time last year than it is this year. The difference of more than 1,000 infections compared to last year, and more than 2 times the number of people passing away over last year. The best way of protecting ourselves is getting people vaccinated and making sure they're able to get the booster. With the rise in numbers, we're expanding vaccine clinics, including those based out of our local schools, which we've been running. And you'll be seeing next week we have clinics at the Albany Airport, Manans Union Free School, where we will be back at the Blue Creek Elementary in Gilderland the following weeks, along with others to follow. So we are really trying to get out there, and with the pharmacies and everyone else out there and the sheriff's department out there giving vaccines, of making it convenient and easy for people to get it done. We know that the infection rates are going to increase after Thanksgiving tomorrow. Was one of the reasons why we're doing the briefing today. We're set on pace to cross the numbers of last year, and it's alarming. And I just want to say, people, I know they want to get together. with their families, just do it safely. If you're not vaccinated, wear a mask, stay 6 feet apart, clean your hands, cough into your arm, everything that we've talked about, and we'll get through this. And if you get tested too, please get tested before, get tested after. We have seen an increase in people wanting to get the vaccine before tomorrow, that were either traveling or planning on getting together with family. Either they want to get the booster shot, their first shot, or second shot, which is all good stuff. I don't want to be up here and deliver bad news, but my highest priority is protecting the health and safety of our residents of Albany County. We can't stick our heads in the sand and pretend like we're not dealing with anything. So I have to say to people, I said this early on, I said it 23 months ago, and I was hoping I was wrong. It's a marathon, not a sprint. We're going to be in this for a while, and it's probably going to go well into the spring of next year. I know the mental health of people has really been affected the most. I know people with opiate addictions and other addictions are falling at the wayside because of what's going on. I kept saying we had to reimagine the world, the workforce, what we did with things in life and how we handle things going forward, and especially dealing with families. It's tough. I get it. But we all need to do our job. We all need to do it. And like Bill Belichick said, just do your job. You do your job, we'll get through this. But it's not going away. We can't wish it away, I can tell you that. Remember in January of this year, we had 89 COVID deaths in Albany County, 89. And I don't want to see that number again. I don't want to go down that road. And I'm afraid of the way, the direction we're headed today. It's going to happen. It might happen in December. It might not. And I'm not here to scare people. So all my Facebook people, I like to put the comments out there. I don't want to be sitting here. I don't want to be preaching this 23 months later. And I sure as hell don't want to be scaring people and saying, get your shot, get vaccinated, or something's going to happen to you. So please, we can get through this if everyone rolls up their sleeve and gets the vaccine. Just to put a little things in the right view, the situation in Western New York is the worst of any region in the state. The Finger Lake region is close second, and we're not there yet, but the situation continues to get worse. After Thanksgiving, it gets to where Western New York is now. We're considering our new COVID restrictions. The governor also will be discussing possible implementation of new health regs to protect New Yorkers. Infection rates continue to rise across the state. We've had meetings, and just to give you a little idea, the 7-day average, Albany County, we're 5%. Not bad compared to other counties. But let's remind everyone, last year, the biggest argument where Dr. Whalen and I were having was sports, and we had to get to less than 4% to open up sports again. We're at 5%. And I know we're not looking at the matrix like we did last year, and things have changed, and we're basing it on hospitalization beds, and we're basing it on ICU capability. But just think about that. How far we've come, we change. You make rules, you make decisions based on the health and safety of the people we represent, and things change. We learn from things we did last year, and we've changed, and we adapted. But I just want people to think about that. 5%, we'd be shut down. Remember, couldn't even get movie theaters open, couldn't get rolling Guptals open. You couldn't do anything because we're at that 5%. Schenectady County's at 5.9%, Saratoga's at 7.2%, Columbia's at 8.6%, Warren County 8.9%, Washington County 12.4%. Currently the highest of any individual county in the capital region. So, that's just the positive rates. The regional rates, again, capital region as a whole, we're at 6.8%. New York City as a region, 1.7. Mid-Hudson Valley region, 2.9. North Country, 7.2. Finger Lakes, 8.6. And Western New York region, 9.7. I would prefer the governor to act instead of Albany County have to go it alone, like Mark Poloncarz did out in Erie County and came up with 4 points. We've been on numerous phone calls with the governor this weekend, Sunday, Monday, talking about different things. President Biden put a executive order out through OSHA through 1910 that saying by January, every workforce over 100 has to be vaccinated. I know that's being challenged in federal court right now, but I have imagined that will pass. So OCA passed mandatory vaccines. I don't want to go there, but we're almost there, and we need to continue to do our job, and we need to work on this together. And I don't want to keep coming up here saying I'm going to take steps and mandatory stuff, but I'm getting there because the numbers aren't better. And people can argue the masks don't work, whatever. We know what works, what doesn't work. It's just another tool in the arsenal that helps somebody from spreading it or getting it. We're not saying it's perfect. I'm not going to argue masks are perfect. I'm not going to argue anything that we're doing is the perfect solution, but we need to continue to work together as a community. Stop finger pointing, stop fear-mongering, stop saying things don't work and threatening people that don't believe in the vaccine or want to wear their mask. We need to work together. So we need to get people the shots. We need people to wear the masks. As I was saying, we need people to get tested. Testing has become an issue. And one of the things we have identified, which is really unfair with testing, and again, you tend to move forward and you forget. And this has really affected the Black and brown community, is testing. It's not available. If you go get tested, it's $125. Now think about it. It's one of the reasons why we work with Dr. Whalen's team at the health department to get kids back in 7 days. But people who don't have children in school, every time they have the sniffles or a kid has known allergies every year, they have to get tested before they go back. It's $125. You can't do over the counter. You can't get the two at Walgreens or CVS or whatever, Lincoln Pharmacy or Mars Pharmacy for $20, or Crestwood for $25 for two. You have to get a PCR test every time they're out. And that's why we went from 10 to 7. But the reality is we need to make testing available to people and do it cheaply. We need, one of the things we're pushing for in NISAC, we wrote a letter and we talked about is getting free testing back up again so people can get tested. Because, I have to say, I met a parent outside Central Med, and the father was so irate. It was his third time. He goes, $375 now I've spent to get my kid back in school, and I'm tired. I don't have the money. And I didn't really think about it at that point in time, saying how many other people just can't get tested because they can't afford the $125. How do you keep kids in school if parents got to pay $125 and not workers going back, or if you need it? So it's something we've been working on, and we need a partnership with many organizations to get this cheaper and get testing back up and running. That is free. That is free. So I support NISAC's recent letter to the Governor Hochul to help continue to purchase and distribute rapid tests and set up testing sites at universities and community centers like we had before. So, and there is some good news. 75% of our Albany County residents that are eligible have the first shot. 67% have the second shot. So we're almost there where we need to be. And this is definitely, and I'm going to get into some numbers, this is really about people that aren't vaccinated and why we continue to go down this path. And remember, any adult over 18 now can get the booster shot. And the vaccine weakens over time. It's like the flu shot. Do we not get the flu shot every 12 months? Right? It doesn't last forever. It gets weaker. And the same thing with the vaccine that everyone's getting. It has showed how much it drops. J&J, was the most effective, but it drops the quickest, down to 40% over a couple of months. So the booster shot, yes. And to everyone that said who got the first and second shot, there was the extra lines, and everyone's like, see, they knew. Well, it's just the way they print a card. It's the way they print it, but they didn't print a card just for 2 shots, or 1 shot. But I get it. No one wants to get a booster shot. They're afraid of it. They're tired of it. But please, you did the right thing for the first and second shot. Do the right thing and get the third shot and continue to protect yourself. So the booster shot for adults is available 18 over, but I want to bring these numbers up. So far in November, there's been 14 COVID deaths. Over 57% of those people that pass away were not vaccinated. 57%. All 43 people that passed away in September and October and November, nearly 63% of them were unvaccinated, and nearly 35% were fully vaccinated. Dr. McKenna was just on the Paul Vandenberg show today talking about everyone in the hospitals unvaccinated. I don't know how many times we have to put it out. There are people that have gone into the hospital with 1 shot, 2 shots, but they didn't end up in ICU. here in Albany County. I can't speak for the rest of the world. I do follow most of it, but I can't speak specifically county to county. But here in Albany County, the people that ended up in the hospital, 1 or 2 vaccines, were just there for a couple of days and got out. Never got to the ICU, and thank God never passed away. And that's what we said. It's doing its job. So over the 41 currently hospital cases today, 39% are fully vaccinated, 61 are not, like I just said. If you're feeling sick, even if it's just a sore throat, a little cough season, please stay home. And it's better safe than being sorry. As we're celebrating with friends and family this Thanksgiving, I encourage everyone to get vaccinated or get the booster, get tested before the celebration. We also need people to get the flu shots, so please go out and get your flu shots. And again, we don't want to see the spike in COVID. It went up, started to go down. It's kind of going back up again, and we'll see what happens over the course of the next couple of days. We just need everyone to do their part. I can assure you, I don't want to have to implement stuff like it's going on. Mayor de Blasio did down in New York City with mask mandates, and people have to have their COVID card shown to go into a restaurant, because I know restaurants are hurting. They're struggling to stay open. They're struggling to get workers, and I know, again, I challenge anyone in this room to walk out to any shopping center or any corner store. No one has a mask on, maybe one person if you're lucky. And I know what we said, and I'm not going to apologize saying that if we got fully vaccinated, we didn't have to wear the mask. I said that to all our county workers. And then I had to make people start wearing masks again in our buildings, because the workers that aren't vaccinated want to take their mask off and get other people sick. So unfortunately, I had to punish everyone in the county for the bad actors that don't want to roll up their sleeve and do the right thing. So again, I'm not trying to make this against unvaccinated people, but if we want to get out of this, we need to roll up our sleeves, get the vaccine, so we can move forward. And as kids, and we've had a great turnout at our health department for children. My deputy, someone in my office went through it with their children, and it was a great experience where they got to sit there and talk to the doctors. They got that one-on-one. The same thing with pediatricians, so a little bit slower with the children, but it's great. That's why we've done pods in schools, but we haven't done big pods, because kids from 5 to 12 have to be treated differently. You don't want to make them feel like they're going through this big maze and scare the hell out of them. We want them to feel comfortable. We want the parents to feel comfortable, and we want the parents and even the child who's 5 or 6 who might have a question about this, we can answer it, and we'll get through it. So again, I do want to say to everyone, I hope you have a good holiday. Please enjoy it, but do it safely, and help be part of the solution, not part of the problem. And we'll get through this. And again, remember, it's a marathon, not a sprint.